Kaushik. So we have Dr. Kunal here. He's going to be talking about the post-LASIK dry eye.
Good morning all. I'll be in hurry. I will be discussing dry eye post LASIK. Not this much. Starting with the refractive error, brief overview. Recent studies have showed that 43% of visual impairments are attributed to refractive errors. 88.4 million are affected by refractive errors in age group of 20 to 30 years. Refractive errors are managed with glasses, contact lenses, refractive surgeries. The milestones are in 1960 we got radial keratotomy, 1981 we got photorefractive keratotomy, then LASIK came in 1987. LASIK is the first choice of correction of refractive errors in majority of patients with very high patient satisfaction rates and significant improvement in quality of life. About 20 million procedures performed worldwide. But LASIK doesn't come alone. Dry eye disease is a common complication after LASIK. Pre-existing dry eye syndrome is often made worse, and those who don't have any history of dry eye get dry eye. If you look at the numbers, let's see the clinical scenario. Post LASIK 6 months, patient is 20/20, both eyes, but not happy with the vision. Eyes get tired while working on computer, can't see the monitor for a long time, glare in night driving. It is post-LASIK dry eye. If we see risk factors, pre-existing dry eye, women, Asian origin, comorbidities, patients that require more refractive correction, ablation depth and thickness, hinge position, and more suction time in surgery. If the pathophysiology has to be discussed, there are many unknown factors which we have not thought of: inflammation, mast cell degranulation, cytokine release, and apoptosis of the cells. But the most commonly accepted hypothesis about post-LASIK dry eye is neural damage, which leads to less corneal cessation and decrease in goblet cell density, leading to less of tear secretion and mucin secretion, and destabilizing the tear film and damaging the cornea and conjunctiva. How big is the problem? Glare and blurring of vision can hamper work and cause mental stress. Some symptoms may not entirely resolve, which reduces patient satisfaction level, and reduced sensitivity may lead to neurotropic keratitis. Around 5 out of 10,000 patients complain of that. If we look at the prevalence of dry eye post-LASIK, it is most common complication after LASIK, affecting around 50% of patients 1 week post-operatively, 40% at 1 month, 20 to 40% at 6 months. Approximately 20% of patients experience dry eye symptoms that were worse and significantly worse than pre-operative stage, while the majority of cases improve, but 20% of cases may persist after 6 months also. Management approach: pre-operatively we have to look after the lid abnormalities as discussed earlier, tear film abnormalities, and contact lens wear, which is very important in LASIK patients. We can investigate with T-BUT, tear meniscus height, and look for inflammation. Regular post-operative management includes topical antibiotics for 1 week, then topical corticosteroids for 2 to 4 weeks in tapering doses, and non-preserved artificial tears. In management approach for post-op DED, we start with tears first, preserved or non-preserved, and look for the lid margin diseases. We can give thermal massages, lid scrubs, and even antibiotics in the night. Nutritional supplements are very helpful in meibomian gland dysfunction. Topical anti-inflammatories are given like cyclosporin and steroid if inflammation is there, and if the cases are refractory, punctal plugs, oral doxycycline and autologous serum is helpful. Let's talk about the most commonly used agent in post-refractive surgery dry eye, that is the preservative-free tears. Mostly 86% of patients show improvement with this only. Let's talk about some newer artificial tears containing sodium hyaluronate, effective in dry eye post LASIK. Hyaluronates binds with water and resists dehydration, promotes epithelial wound healing, viscoelastic property enhancing residence time. We'll be talking about these. For viscoelastic property, during blinks, shear stress causes the molecule of hyaluronate in a solution to align with another, resulting in easily spreading over the surface of the cornea. In between the blinks, the molecules of hyaluronates form tangled meshwork and the solution becomes less elastic, more viscous, which lead to more residence time of the solution on the surface and helps in lubricating. If we see improvement in T-bud was studied by Park et al. In two groups, cyclosporin and hyaluronate in 176 patients. In both the groups, it showed clinically significant improvement in T-bud at 6 weeks and 12 weeks, with hyaluronate scoring over the cyclosporin. Improvement in lipid layer thickness. More than 75% of patients have meibomian gland dysfunction, which is the most common evaporative dry eye disease. A fourfold increase of tear evaporation is observed. Thinning of lipid layer can lead to increased evaporation of underlying aqueous layer. There has been an added advantage of hyaluronates where they form a complex with fibronectin and help in epithelial cell migration and accelerate the corneal wound healing. To summarize, sodium hyaluronate tear substitutes effectively blind water and resists dehydration, promotes epithelial wound healing, improves lipid layer thickness, and increased tear film stability. There was a study by Wu et al. In 2021. The purpose was to evaluate and compare the effects of intense pulse light, 0.1% hyaluronates, and hot eye mask in participants with persistent post-LASIK dry eye disease. In summary, the results suggested that combining all three therapies are helpful in reducing dry eye disease following LASIK surgery. Key takeaways: post-operative dry eye syndrome is very common after LASIK and can contribute to ocular morbidity and suboptimal visual results. It is vital to identify patients at risk for post-LASIK dry eye syndrome, treat them preoperatively and postoperatively. Newer lubricants like hyaluronates and polyethylene glycol 400 are useful in management. About 85% were relieved of symptoms with lubricating drops.